Medicare has many parts and plans, and those parts and plans, well, those costs can really begin to stack up. So what if you could get a Part D plan for free? Well, let's talk about that in today's video. Hi there, as always, a reminder that we are licensed health insurance brokers. So if you have any questions whatsoever about your Medicare coverage, you can reach us at the number on the screen or at the comments below, and there is, of course, no charge for our services. Now, we release these videos on a weekly basis, so please make sure to subscribe to stay up to date, and of course, click that like button so we can get this information out there. So today we're going to be talking about the Part D AEP and the changes for 2024. Now, unless you're enrolled in a Medicare Advantage plan that offers prescription drug coverage, you'll likely need some type of prescription drug plan. And those are, of course, Part D plans, which are strictly prescription drug plans. Because remember, original Medicare does not offer prescription drug coverage except very, very limited exceptions. This list is available on Medicare.gov, and these are the prescription drugs covered under Part B. And you'll see here, usually Part B drugs you wouldn't typically give yourself. So the pills that you take every day to cover some of those more basic ailments, things like high blood pressure or cholesterol or thyroid issues, or even antibiotics if you have a sinus infection, wouldn't be covered under Part B. However, these types of medications would be. The Alzheimer's drug, drugs used with durable medical equipment, some antigens, injectable osteoporosis drugs. So you can see these are things that are mostly administered by a doctor, blood clotting factors, injectable and infused drugs, oral end-stage renal disease drugs, that's very important. If you scroll down, you see that shots and vaccinations, transplants and immunosuppressive drugs, oral cancer drugs, oral anti-nausea drugs, so that has to do with chemotherapy and cancer-related drugs. Because these are falling under Part B, basically you'd be responsible for 20% of the Medicare-approved amount unless you have a Medicare supplement plan that covers your Part B coinsurance. Now, Part D plans are offered by private carriers, but they are federally regulated. Every year, the government sets the financial limits for the different stages of Part D. Specifically, we're talking about the deductible, the initial coverage period, the coverage gap moving into catastrophic coverage. So let's talk about those numbers in 2024. So in 2024, the maximum deductible that any plan can charge is $545. That's up $40 from $505 in 2023. Again, this is the maximum deductible. Plans can choose to offer lower deductibles or even no deductible to entice beneficiaries. However, you'll usually notice that plans with lower deductibles have higher monthly premiums. That's not always the case, but there is usually an inverse relationship there. Before you've met your deductible, you'll have to pay for your prescription out of pocket. Although almost always those lower tier medications will be covered prior to meeting the deductible. Once you've met your deductible, you'll move into the initial coverage phase. At this point, you'll be responsible for a copay or coinsurance dependent upon the tier of the medication. Medicare will keep track of your spending as you approach the coverage gap. And in 2024, that limit is $5,020, which is up from $4,660 in 2023. Once you've entered the coverage gap, sometimes referred to as the donut hole, you will notice that your prescription drug costs will increase. If you keep spending and you reach $8,000, at that point in 2024, you will enter into catastrophic coverage and your costs will dramatically decrease. This is up from $7,400 in 2023. Now, some other important changes. You probably already know that insulin is now capped at $35 for a 30-day supply. However, now also preventative vaccines such as the shingles vaccine will be covered at no cost prior to meeting the deductible. Medicare Part D plans can be rather inexpensive. You can often access a plan for as little as a few dollars per month. However, some plans can be much more expensive, upwards of $50 per month. Now, as far as what's the right plan for your needs, well, it depends upon your specific medications, the area in which you live, and a variety of other factors. But let's take a look at the plans, specifically those $0 per month plans. So as usual, let's check out Medicare.gov. Scroll down here where it says Find Plans Now. Coverage for 2024, we'll put in zip code. We're just looking at Medicare Part D plans today. Then it's going to ask if you get help with your costs. We'll put I don't get help from any of these programs.
Then, of course, it asks if you want to compare your drug costs. Definitely you do. So we are going to put in 2 different prescriptions. I will put in one generic and one brand name. Make sure that you're getting the dosage and the quantity and the frequency correct. All right, let's add another one, and this time let's add a brand name. Okay, so that's it. It's going to ask for pharmacies. Always recommend that you pick one mail order pharmacy in with the mix. Okay, so now it is currently sorting based on lowest drug plus premium cost. So it's actually recommending that this plan here with a $5.20 monthly premium is going to offer the most savings based on the drug information that I put in. But if you were to scroll down, you'll see here we have a plan with a $0 monthly premium. Now, if you wanted to see plans sorted just by the premium cost, which is basically what we're talking about today, then of course it's going to prompt you to look at this plan first. And it not only includes your monthly premium, it's giving you an estimate of your yearly cost, which is your premiums plus the drugs that we put in with this plan. So it's showing you a pretty significant savings at the mail order pharmacy versus the retail pharmacy. Now let's take a look at the plan details. Here's some important information. So we're looking at a snapshot of the monthly premium, estimated yearly cost, and very important that it covers both of the drugs that we put in. So if you scroll down, you will see that of the 5 pharmacies we put in, including the mail order pharmacy, 4 are preferred in-network. Sometimes you'll see that something is in-network but not preferred, and you'll notice that those costs will be more expensive than at a preferred in-network pharmacy. Let's take a look here at the costs. So basically, most of our costs are coming from that prescription brand name drug. The generic drug is at no cost. You'll see that we won't enter the coverage gap based on the information that we put in, which is very good. And then here it's breaking down the cost per month. Basically, these higher costs are prior to meeting the deductible, and then once you've met your deductible, your copay would decrease. So that's why it breaks it down by month as well. And it looks like it's a pretty close race between Walgreens and Harris Teeter as far as your retail pharmacy is concerned. It's a 1 penny difference here and a 5-cent difference here. But of course, the mail order pharmacy is still the least expensive. Now, the reason that you're seeing a higher number here in these dashes is because it's giving you a 90-day supply. So now I'm going to take you to WellCare's site because that was the plan that was offering the $0 monthly premium. Let's pick Arizona. Compare plans and enroll. Okay, let's put in an Arizona zip code. Then we will continue. Do you take any prescriptions? Okay, again, let's try putting in the same medications that we put in before to make things even. Let's do the 50 milligram because that's what we did on Medicare.gov. Although, of course, we're looking in a different state right now. Okay, we will also put in Synthroid. Again, to make it even. Let's put the exact same. It's asking if we want to choose the generic. Now, although we usually recommend choosing the generic to save money, sometimes that doesn't work for people. And for purposes of comparison, we're going to keep one brand name and continue. We're actually just looking at prescription drug plans. So it does offer you Medicare Advantage, but we're talking about prescription drug plans. So look, here we go. So here is a WellCare value script plan offered in Phoenix, Arizona. And this plan is at $0 per month. Now, of course, they have more expensive ones, but we're just talking about those $0 per month premiums. So let's take a look at the details. Now, I'll be honest, this actually gives you a little bit more information than what's available on Medicare.gov, because you can see here that it's listing atenolol as Tier 1, Synthroid is Tier 4, and it also specifically states right here that your deductible is only on Tiers 3 to 6. So that means atenolol will be covered even before you've met your deductible, whereas that brand name Synthroid wouldn't be covered until you've met your deductible. So it lists here the deductible is $400, which is actually a lower deductible than what is mandated. Your initial coverage limit is $5,030. Once you've reached that, you would enter into the donut hole until you reach $8,000, which is the out-of-pocket threshold. If you scroll down, it'll break down the costs depending upon what coverage period you are in. Continue to scroll, and it's just going to tell you in general, not just for your specific prescriptions, but in general, what the costs would be based on the tier of the medication. And that's basically it. This is, of course, the formulary, which is very important if you're looking up additional prescription information. Now, a lot of this information likely could be found on Medicare.gov as well, and of course, your broker would be able to assist you with this. But on Medicare.gov, you just might have to do a little bit more digging. So that's it for WellCare. I just wanted to give you an example of some of the plans that are being offered with a $0 monthly premium, and you should be able to access these types of plans in most states. Now, as to whether it's right for you, of course, depends upon the prescription drugs that you are taking, as well as your budget and your location.
Remember that the AEP is from October 15th to December 7th, and there can be a late enrollment penalty for Part D, so make sure you enroll on time. So what do you think? Would one of these $0 per month plans work for you? Let us know in the comments below.
Before you leave, if you want to learn more about the costs in each of those stages of Medicare Part D and the dreaded donut hole, make sure to check out this video. Oh, and please make sure to subscribe and like this video as well. We'll see you next time.